Hello there, and welcome. My name is Dr. Calliope, and I'm going to be performing your head and neck assessment today. We have quite a few tools to use, quite a few things to test. And to get started, if you wouldn't mind, I'd like to just grab your name and date of birth. Good. And is that your preferred name? How do you like to be addressed? Wonderful. So, there is going to be quite a bit of inspection in this test. We're going to be doing some sensory and motor examination. We'll bring out the stethoscope a little bit near the end. I have the otoscope, the ophthalmoscope, and a pen light. So we are going to be doing a multitude of different tests. Now to begin, I'd like to take a look at your skin as well as your hair. So from this point onwards, I am going to need to be touching you. Is that okay with you? Do I have your consent to do that? Wonderful. Thank you. I'm just going to begin by getting a little closer here. And I'm just going to take a look. So we're going to look at the skin's color. We're going to look for symmetry in the facial features. We're going to look for example, the presence of the entire eyebrow, that we don't have any loss of hair. Good. We look at the eyelashes, make sure those are intact. Good. We look at the skin's texture and for areas of hyperpigmentation, depigmentation. Assessing the texture as well. Have you had any issues as of late with your skin that you'd like to address? Okay, if at any point you do, just let me know. Good. Just feeling the texture here. Good. And let me take a little look at the hair. We'll be looking at the scalp and the actual anatomy of the head a little later on. But for now, I'd just like to look at the quality of the hair and test its strength, as well as assess the texture. If it seems to be overly dry, brittle, coarse, oily, things of that nature. If there is a lot of shedding, do we need to look at alopecia? Things of that nature. Oh, I'm just taking a few strands of hair and looking at that, and that all looks good. You'll give me just a moment. I'm just going to note some things down. we're going to work with some sensory and motor examination now. We're going to start by testing pressure and soft or sharp sense with the face. This is governed by the trigeminal nerve. It's your fifth cranial nerve. It has 3 branches. That's why it has that tri prefix. So we have the ophthalmic branch, we have the maxillary branch, and the mandibular branch. So to start, I'm just going to assess that you can indeed sense the presence of touch and pressure on the skin, right? So I'm just going to be touching different places on the face. I want you to let me know that you can feel it, okay? Very good. So let's see. Right in here. You feel that? Okay, and what about this? And does that feel different at all? Or do those 2 touches feel about the same? Okay, what about that? And that. Good. And those feel about the same? Good. That. How about that? Okay, and those also feel the same. Wonderful. Now I'm going to continue just testing that you can feel these different touches for a few moments. Oh, can you feel that? Mm-hmm. Good. Mm-hmm. Good. There we go. Good. Okay, and I'm going to press a little harder in there. Does this feel like there is more pressure? Good. And what about here? More pressure? Here? 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 And here? Good. Good. So now I'm going to bring out a little tool. It is very conveniently cased within this Tromner hammer here. This is a neurological reflex hammer. And in the bottom here, we have a little compartment that houses a little pointed tip here and a soft brush. So I am either going to touch you with this pointed tip here. It's not sharp by any means. See, I can press quite firmly and there's no puncture. Or the brush here, the soft touch. I'm going to test these on your jaw so that you know what that feels like, what you're looking for. So this is going to be the sharp right here. Just tap, tap, tap. Just like that, okay? And this one will be the sharp, or the soft rather. It would be a little odd if this one was the sharp. So we have soft, soft. Just like that. Did those have distinct differences in how they felt? Good. Now you just let me know whether you feel the sharp pointed tip or the soft brush right? Good. Sharp. Soft. Sharp. Soft. Soft. Sharp. Sharp. Soft. Sharp. Soft. Sharp. Soft. Wonderful. So, the sensory aspect seems to be functioning correctly. Now we're going to go for the more motor aspect. So I am going to be feeling around the Masseter and the Temporalis muscles here. We're also a little bit down the line going to look at the TMJ joint, but for right now I want to focus on the muscles. So I am going to just palpate right in this area. This big muscle right here, very powerful. And I would like you to just clench the jaw, unclench, clench, and unclench. Good. Now I'm going to assess that at the temporalis here. So if you could clench the jaw and unclench, clench, and unclench. Good. And did it feel like there was any weakness on your side at all when you clenched your jaw? No. Okay. And do you normally have any restriction or any weakness in the muscles while you're trying to chew something, for example? No. Wonderful. You'll give me just a moment. Now let's take a little look at the sinus cavities. So you have your frontal sinuses, your ethmoid sinuses, and your maxillary sinuses. I'm going to be pressing and tapping on these, and I want you to let me know if there's any pain or tenderness at all. All right? So let's start with the frontal. Any pain when I press into the forehead? No. And the ethmoid? Any pain there? And what about the maxillary? Any pain with that? No. Okay. Now I'm going to do our direct percussion, and I'm going to be tapping along these areas. Sometimes that can elicit some tenderness. Let me know if it hurts at all. We're just going to tap, 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 tap all along the frontal, sinuses? How was that? And what about the tap, ethmoid sinuses here? Okay, and what about the maxillary? How was that? Just fine. Okay. Now we're going to circle back to the temporomandibular joint right in here. So I am going to palpate around here, focused in on the joint as opposed to the muscle. And I'm going to have you open the jaw a few times. So if you could open your jaw, close, open, and close. Okay, good. And again, no restriction, no pain. Okay, very good. Now let's work with the scalp and the head as a whole. I'm going to be assessing the actual contours of the skull, as well as looking at the skin itself for any abnormalities. I'm going to get in a little closer here. I like to start right at the hairline. It's a very easy, accessible place to start. And then we can come behind the ear and look at the hairline as well as in the back. And come around the other side. And then we can get into the skull itself, as well as I can part some of the hair and look at the scalp from there. It's not going to give me a completely comprehensive look, but it gives me enough that I have a good view of what's going on. If I do see something that might be worth a second look, then I can get in further. Okay. Just going to palpate here. This feels akin to a massage. Good. Were any of those spots painful at all? No. Okay. So let me just jot that down. Good. And then let's take a little peek at your eyes. So we will be using a pen light for some of this, but firstly I want to get a closer look at the eyes. So not at the skin in general, but getting into the eyes. So we have the conjunctiva, for example, the tear ducts, the lacrimal glands. We have the sclera, the white of the eye, the iris, the pupil. So I'm going to pull up on the eyelid. I'd like you to look down. Up, you look down. Good. And I'm going to pull down, and I'd like you to look up. Pull down, you look up. Okay, that's nice and pink. Good. Good look. Okay, and then the other side here. Have you had any issues with your eyes as of late? Vision changes, itchiness, change in color, wateriness, dryness, things of that nature. Okay. I'm going to pull up on the eyelid. I'd like you to look down. Down. Good. And I'm going to pull down, and I'd like you to look up. Good. Okay. Very good. All right. So let me take a little look at the pupils. So we are looking for the pupils to be equal, round, and reactive to light. So as I've been watching you, your pupils have been constricting and dilating with different movements, with my different distances. Now I'd like to just have you look at my nose here. And we're just going to bring this light in. I know it's quite bright. Good. See the pupils go to pinpoints. Good. Okay, and keep looking at my nose here. There we go. Good. Okay, very good. Now I'm just going to watch them to make sure they go back to normal. Okay, and they are of equal size as they both go back to normal. So now I'm going to sit back a bit. And we're going to test your accommodation reflex. So I'm going to have you look at the light here, and using your eyes without moving your head, I want you to just follow this light as best as you can. And I'm just going to be coming in and out with the light, just like this. In, out, in, and out. Okay, we'll switch to this side. Just look at this line here, and I'll just be bringing this in and out. In and out. Good. In and out. Very good. Now we are going to do some light following, some eye tracking. So if I could have you just focus on this light. We're going to test cranial nerves 3, 4, and 6. Okay? So just keep focusing on this light. If you could just follow it as best as you can. Good. We are testing what's known as the cardinal directions of gaze. Good. Good. Do it a little bit randomly. Just want to make sure that your eyes can move in all directions. We'll test for lid lag here. Good. Down. There we go. Back up and down. Okay, and let's get some diagonals in there. Diagonally down. Diagonally down. Diagonally up. Diagonally up. Diagonally up. Diagonally down. Diagonally down. Diagonally up. Wonderful. Very good. Now, I'd like to test your periphery a little bit. So if you could focus on my nose, I am going to be wiggling my fingers in different parts of your periphery. And I'd like you to just tell me when you see the fingers wiggle. I'm actually going to do it more like this, because if you could hear my hands, then that may give you a bit of a clue. So I'd like you to tell me which side you see the wiggling on, either the left or right. Okay? Good, so just keep looking at my nose. Good. Yep. Good. Yep. Good. 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 Yep. Good. Yep. Excellent. Wonderful. So, next, we are going to do a fundoscopy. And a fundoscopy is where I look at the fundus of the eye, which means the back of the eye. So I'm going to flip this on for a moment. Let's see. Just make sure my lens is in place. Yeah, right where I want it. And I am just going to have you again look straight ahead. I'm going to put my hand atop your head just to steady myself so that I don't accidentally run into you. And I am going to be coming in real close and taking a look at your eye. So I'm going to be looking for what's known as the red light reflex right there. Then I'm going to be coming in and looking around the eye so I can look at the optic nerve and the blood vessels, the fovea a bit, macula. Just looking around and making sure that everything looks healthy. There's no abnormalities here. Good. Okay, and I'm just going to pull back and switch. So let me go ahead and find the red light reflex. Right there. Okay, we can get a look at the optic nerve and the blood vessels. There's quite a few of them twining around in there. As well as just looking at the surface of the back of the eye. Good. Very good. Okay, then I'll just pull back and take this off. Good, and a little later on we will need to replace it with this, so just do that right now. Good, we'll attach the speculum. When we are ready, now let's take a little peek at the nose. So I am just going to use my pen light here since it's got quite a strong light. And if I could just have you tip your head back so that I can look inside the nose. Good. I'm going to get rather close here. Just make sure. Good. Well, from what I can see here, the septum has no deviation. It is midline with no perforation. Good distribution of hairs, and I can see a little bit of the turbinates back there. Just a little bit. Good. And have you had any problems with breathing through your nose, with smell at all, with any pain, dryness, nosebleeds, anything of that sort? No. Okay. So I am going to have you smell something for me. No, it's not chloroform. But I am just going to hold this up to your nose, and I'd like you to tell me what this smells like right here. What does that smell like? Good, okay. That was a bit of just isopropyl alcohol. Rather strong scent. So our first cranial nerve, the olfactory nerve, is intact. Good. Now, let's take a peek at the mouth and the throat. So I am going to have you open your mouth for me. And I'm going to take one of these depressors here. I'm going to have a little peek around the tissues of the oral cavity. Look at the buccal mucosa, for example. And behind the lip here. The other side, looking a little bit at the salivary glands. Good. You could open up just a little bit wider. I want to take a look at the teeth here. Just looking to make sure that they are in good health here. Good. Okay. And I am going to have you stick out your tongue for a moment. We're going to test the hypoglossal nerve, cranial nerve 12. So if I could have you move your tongue to the side, the other side, up, down, And can you stick your tongue to the roof of your mouth? And that way I can get a look underneath the tongue. Okay, good. You can lay the tongue back down. And again, I'm going to give you a moment to rest the mouth here. And then when you're ready, I'd like you to take a dry swallow. Okay? Might take a few seconds to convince your mouth to swallow. I just want to make sure it's one of the functions of the vagus nerve is to help with swallowing. It does a lot of different things, but that's one thing we can test. If you could just take a swallow. Good, okay. And was there any pain or restriction in that? No. Finally, if you could just stick your tongue out again. And I'm just going to hold that down. You could stretch your tongue out as wide as you can. I'm trying to flatten it so that I can look at the throat. And we want to make sure there's no signs of damage or irritation, growths, cobblestoning, things of that nature on the throat wall. That we don't have the tonsils enlarged. And if I could have you say ah, we'll look at the uvula. Good. Okay. I'll take that out. So, cranial nerves 9 and 10 are intact. Let's take a peek at your ears, shall we? So this is where we grab one of our speculums. We can pop that onto our otoscope here. And I am going to do just a little inspection. Primarily, I'm looking behind the ears to make sure that there aren't any signs of lesions. And I'll just be looking at the tissues of the pinna as well. So I'll just start right over here and take a little look at the ear. And let me know if any of this is painful or tender at all. How is this? Just fine. Okay. And I'm just going to pull the ear back so I can look behind. And the skin here looks clear. And the other side here. Just feeling around the ear. The tissues look clear. Folds of the ear, all present. And then we can just stretch that back so that we can look behind the ear. Good. And the skin is clear here as well. Good. So now we can bring in the otoscope. Just make sure I have, there we go, some light. And I'm going to look inside the ears. So I'm just going to be pulling up and back, and this allows the ear canal to straighten out. So we'll do that. Up, and then we'll just press ear back, and then come up and back with this side. Good, and just get that positioned. Good. So, with the ear canal itself, we're looking for example, is there an irritation on the skin? Are there any scratches? We're looking for impaction in the canal. With the tympanic membrane, is it a pearly gray color? Does it reflect the cone of light? Is it partially translucent? With the tip of the malleus in the inner ear visible. And is the membrane intact? Are there any perforations? Okay, just go ahead and put that back. Good, so that all looked quite healthy. Now I would like to test your vestibulocochlear nerve, and we're going to do a little bit of a whisper test. I just want you to tell me what you think I say in one ear or the other. Tissue. Shirt sleeve. Baseboard. Pole. Bark. Okay, and how did those words sound? Alright, and they were pretty understandable. Okay, go to the other side. Clipboard. Porcelain. Tripod. Field. Fox. And how were those? Okay, good. Now lastly, we're going to get into the neck. We're going to look at the neck itself, at the lymph nodes, the thyroid, and we're going to auscultate for any bruits or audible heart murmurs in the carotid artery. So I would like to get up close and just take a little look at the neck. Have you had any issues with the neck? Maybe with restriction in movement, any sort of tightness, pain, enlargement? No? Okay. Sternocleidomastoid muscle is quite apparent there. Very easy to spot that one on you. Okay, good. And I am just going to have a feel of the lymph nodes. I'll start at the back of the head and work my way to the neck and above the clavicle. So I am going to start at the occipital nodes here. And just feeling for the enlargement. Is it stationary? Is it mobile? Postauricular nodes behind the ear. Preauricular nodes. mental and submandibular. We come underneath the jaw. And we have superficial cervical, deep cervical chain, posterior cervical, with the neck. And then finally we have supraclavicular, right above the clavicle. Good. Okay, that looks pretty good. Now with the thyroid, I'm going to have you take another dry swallow. I know that's probably your favorite thing to do. So I'm going to palpate around, and I'll let you know when I need you to swallow, making sure the trachea is midline as well while I'm here. Good. And if you could just swallow here. Okay, good. Good. Now, before I bring out the stethoscope, I'd like to test a little bit of the range of movement. So, firstly, I'm actually going to have you shrug your shoulders, or the accessory nerve. Okay. And how is that? Any restriction, weakness in that? No? Okay. And I'm going to have you turn your head to the side. The other side. Good. Tilt the head. And tilt. And go back as far as you can. And forward as far as you can. Okay. Any pain or restriction in any of this? No. Okay. So let me unbury my stethoscope here. I keep it on me so that I don't lose it, but then I still lose it within the confines of my hair. Now I am just going to put the diaphragm of the stethoscope on the carotid artery, and I'm going to do both sides, one side at a time. And I'd just like you to take a deep breath in and hold it. And let it go. Deep breath in. And that's it. All that fanfare for the stethoscope, for that little test. But I did not hear any bruits in the carotids, which is good. So I'm going to do just a bit of palpation here. And just feel the strength of the pulse here. Good, and the other side. Good strength. Good. Excellent. So that will conclude our examination. Just going to write down my final notes. And do you have any questions for me at all? Okay, I will go ahead and sign off here. And that will about do it. I'd like to thank you so much for coming to my office for this head and neck assessment. I hope you have a whale of a day and a good rest of your night. Thank you. Bye now. Thank you so much for watching. I really appreciate it. If you enjoyed this video, it would greatly help me out if you clicked the like button and left a comment so YouTube's algorithm registers that it was a good video. If you want to see more of my work, consider subscribing to the channel. I create primarily medical, pseudoscience / alternative medicine, and personal attention ASMR roleplays. But I've done a little bit of everything from historical to sci-fi to fantasy. If you'd like to support the channel, I offer ad-free videos, early access on videos, and exclusive content on Patreon. Or I also have a Ko-Fi link for a one-time donation or a throne wish list for props and equipment. Thank you again, and I hope you have a whale of